Good morning, good afternoon, and hello, depending on where you are and where you're listening. All right, thank you very much to the previous speakers, and I'm going to go through things quickly to stay within time. It doesn't mean that I am not thinking some things are more or less important than others, but here we go. All right, so I really like this quote attributed to George Bernard Shaw, right? The single biggest problem in communication is the illusion that it's taken place. So again, you know, we'll be talking about the importance and influence of the language access field and the health literacy partnership and its role in attempting to obtain healthy outcomes. So the key concepts and the three things, well, there's quite a bit. But, you know, then again, that's a whole don't get me started. So but for now, we're going to be touching on some of these. All right, so the first thing, one of the things I wanted to do was talk about the term language access versus language assistance. And so I hesitated to have this much text for this kind of crowd. So basically, language access is more focusing on equity. And language assistance is focusing more on the methods of service delivery. So are we talking about in-person for sign language and spoken language interpreters? Are we talking about video remote interpreting when it comes to language assistance? Are we talking about remote simultaneous medical interpreting as well? And then also, too, within the, I'll say, language access field and within the interpreters, you know, there's also a question of, do we limit this term to language access, or is it more communication access? So that's just something to think about as we move forward with this piece. And so then the key concepts, I'll be touching on three of them. The first one is the federal, state, local, and organizational. So first, you know, what are the, as I talk about this in different places, my questions are, do folks know what policies are in place? It's amazing to me how some folks are not aware of, for example, Title VI, Office for Civil Rights, the American with Disabilities Act, the Executive Order 13166, which carries the four-factor analysis. And also the other questions maybe are more, you know, drilling down a little bit, is what do they know regarding the policies in respect to their own state, their own organizations? What do they know what the demographics are within those, about those whom they serve? What are the top 5 languages, not only in our home states, but within our organizations as well, because those could be a little bit different. And then also, too, what part of this is part of the health exchange? And so these are all different questions that we ask about. And also, too, the accreditation bodies. One of the examples I used recently was, you know, the Joint Commission, who has some accreditation regarding language access. But then, you know, for example, in some parts of rural upstate New York, not everybody is accredited by the Joint Commission. So that's kind of like, oh, well, then I guess we're off the hook. Well, no, not really. Okay. So then again, back to my question of what's the awareness of some of the other regs and policies. The other key concept, and this is wearing my interpreter hat, and as my worlds of policy to practice merge, is education about the role of the interpreter and/or translator. And so one of the things that I ask folks about, and the third point I'll be talking about is community engagement and empowerment, but a little bit more regarding the role of the interpreter and/or translator. So my questions, what I ask is, what's the difference between these roles, because they are used interchangeably, and apologies to those who know this is a whole don't get me started topic. And I'm doing this so that I don't have to be muttering under my breath interpreter when somebody says translator, you know, or when somebody says the word language line, and I'm talking about telephonic, okay? So the difference between these three is bilingual is someone who professes to speak 2 languages, okay? And their language skills have not been assessed. So I could run around and say that I speak French, and my French based on the ILR or ACTFL scale is maybe, you know, novice to low conversational. So interpreting is the oral communication, translation is the written communication, end of story, okay? This is it. And so I'll then hear, now that you know it's, you know, translation is the written, I will hear this term simultaneous translation, all right? This to me, I am muttering under my breath because then this individual has now lost me. This is simultaneous translation. You're writing with both hands, okay? And here, you're using a minor, okay? I'm just saying, all right? New York State and California are 2 states that I'm aware of that have in their regs not to use a minor. They don't use child, here we go. They use minor, don't use a minor, all right. All right. So then this is a slide that I really like, and again, apologies to those who have seen this. This is simultaneous interpreting. So before we started, I went up to the booth and I asked if they had any interpreters in the booth, especially when I'm working with sign language interpreters. If I'm going to be using very specialized vocabulary, I give them a heads up. Because if a sign language interpreter has to interpret pneumococcal phase 5, IV flush, and feeds by gravity, let me tell you, they're going to give me that look that I've often given providers when they use that and they don't give me a heads up, right? All right, and then here, this is one of my favorites. This is President Obama and Pope Francis with his interpreter, Monsignor Mark Miles. If you notice, the president and the Pope are engaged, they're laughing. The interpreter is off to the side. He's not laughing, he's not part of this conversation because we're not. As interpreters, we are not, all right? So how do we know somebody's a good interpreter? All right, so what we have currently, and these are some of the things that have helped move this integration forward, is certification for interpreters here. I have 3 that are focusing more on healthcare. There are others out there. So we have the National Board of Certification for Medical Interpreters. We have Registry of Interpreters for the Deaf. We have Certification for Commission for Healthcare Interpreters, keeping in mind that's not all certification is available for all languages, okay? So what do we do in the absence of that? There are certain qualifications. So are we looking at somebody whose language skills have been assessed? Not self-assessment. Self-assessment is sometimes a tricky thing, right? What kind of training have they had? And also, too, what levels of formal education within some languages have some of the interpreters had, right? Because you're going to be trusting the interpreters. We also have our code of ethics. Some folks found it interesting that interpreters have a code of ethics. Well, you know what we do. And then also to our standards of practice. Because all of this is going to really, really play out when we are interpreting preoperatively and we're converting terms such as health proxy, advanced directives, living wills, which are concepts that don't exist in some of our countries. And then also we're going to be talking about a copay, a deductible, and out-of-network and out-of-pocket. And also, we're going to be talking about, for example, if we're talking pre-surgical, we're going to be explaining to that patient, oh, what meds are you on? Okay, of all those meds, don't take A pre-operatively. But what you could do is you could bring med B with you that morning and then take it after the procedure. Or what we're going to do is we're going to take your med C, ask you to hold off on taking that because we're going to give you med D, and then you can resume med C after everything's done. Okay. You know, so again, what's the health literacy involved? What is the language access? What is the cultural competency piece? Keeping in mind sometimes that, you know, our meds have different names. Some require scripts in our countries. Some don't require prescriptions in our countries. And then issues of measurement as well. And so also too for translation certification guidelines, you know, we're dealing with discharge instructions and written materials as well. Because, you know, when we all ignore all of this, we get false fluency. Here, you know, this has turned into a false cognate, you know, language pairs, and I just found this on the internet, but, you know, they've made the Spanish by adding an O to the end of the word, so, you know, you add an A or O to the end of the word, and poof, it's Spanish, right? Well, and because here, you know, what this means is that, you know, he's successful. Éxito is successful, you know. I think because they use an accent mark and a capital E is, you know, I'm supposed to be appreciative. All right, so then now, you know, we're talking about community engagement and empowerment. So, you know, this is something where we're looking at, you know, educating the end user, whether that be the patient or the provider, the workforce, the individuals. We really need to be aware of this also regarding mandates that are involved. This is not just something nice that we're doing. Now we can go ahead and point to some federal things. You know, so we ask, you know, when the provider has an awareness of these federal, local, and state mandates, you know, you call us, and that's a positive, but then, oh, well, you know, we already took care of it. Really? How? How did you take care of this? So, you know, this is a concern. Utilizing a professional interpreter would be really helpful and empowering the community to know that this is their right, letting the provider know that we as interpreters are there for the provider as well. And we also ask that, you know, that materials continue to be reviewed for their cultural competence. We ask, you know, don't talk louder and slower when you're speaking to somebody who doesn't speak English, or, for example, for the deaf and hard of hearing community, that distortion is really not helpful. And also, too, address us by our appropriate titles. We're not interpretive, you know, that's a dance. Although sometimes, you know, we feel that. All right, you know, we're not interpretators, we're not interpolators, and we're not translators because we'll be looking for a written document. All right, I'm just saying. These are the three pieces that I feel that have really helped move this forward from an interpreter perspective, looking at disconnects from policy to practice. We now have these to point to so that it's not just us saying this is what we should be doing. There's substance behind it. The next step then would be the dissemination and then the continued enforcement and evaluation. And so I wanted to just go through an effective communication very, very quickly, but I see that I'm out of time, so I'm just going to move forward. Patient-centered care is communication-based and at the front line to addressing issues contributing to health disparities. When we do not speak the language of the individual, we must use an additional set of skills to continue to provide excellent patient care. Thank you.